Hey everybody, it's Dr. Brian McKay, Core Health and Darien, and let's talk to you today about a hiatal hernia. Now, the first thing you probably wonder, what's a chiropractor doing treating hiatal hernias? Well, let's explain what it is first, and I'll get into more details. The hiatal hernia is a condition where the upper part of your stomach bulges through an opening in your diaphragm. Your diaphragm is a muscle that separates, it allows for inspiration and expiration of the lungs that moves up and down. There's an opening there where the stomach starts. Once you go through the esophagus to the stomach, and the diaphragm helps keeps acid from coming up into your esophagus. Now, typically, um, it can be quite painful, and actually, you may not even know you have it for one thing. So it's obviously not that serious, but it does get more serious when if you find blood in the stools. Um, then you really need to see your medical doctor first. This is not, as a matter of fact, let's take it one step further. You need to, if you have these kind of gastrointestinal symptoms, you need to see your medical doctor. As I mentioned, I am a chiropractor, and years ago I learned a special technique that allows that opening to work much more to restore it, because the diaphragm is a muscle, and if it gets torqued out of place, like say you were in a car and you had a car accident, you jam on the brakes and your seatbelt restrains you. Well, you can cause the ribs to subluxate. Subluxation is when bones go out of place, and then it puts stress on the system. Like typically for a bad low back, for bad low back, you would have you're going to have different types of nerve pain. The diaphragm is a little bit different because in this case here, it's going to affect the organs. So what we want to do is we want to make sure that the opening is working properly. And if the ribs are torqued out of place, we correct the rib torque. And a lot of times too, you'll have some thoracic vertebra involved. So in a sense, we're correcting the ribs, not really, and because the diaphragm attaches to this connective tissue to the ribs itself. That's how we achieve any kind of thing. Then we have to basically pull the muscle down. Once you reset the ribs, you kind of go underneath the xiphoid process, which is the bottom of your sternum, and start pulling the thing down. Now, typically, some people would say you take water and you jump off a step, drink some warm water. Again, you're trying to fill your stomach up and then pull that thing down. But you can go in and actually, reach underneath the sternum and tug and start pulling the stomach back into the normal confines. What happens in many cases, though, is that you really start having the medications are a little bit they're kind of scary. Some of the medications, like really called proton pump inhibitors. Now, that's a really big name, proton pump inhibitors. And for the most part, they're safe. But what we see is long-term um, proton pump inhibitors have the effect of your increased risk of fractures, pneumonia, diarrhea, low magnesium, low vitamin B12 deficiencies, dementia, chronic kidney disease. So it would behoove you to, first of all, everybody, you can lose weight and change your diet. That's probably the easiest way to deal with the hiatal hernia. But you know, kidney disease, that's not good. You know, and it gets a little bit worse. I mean, some lupus, systemic lupus can occur as well. So you got a lot of stuff going on. But just think about it. If you got stomach acid reflux, where you have heartburn, shortness of breath. Again, the real scary one is when you have blood in the stools. Anytime you have blood in the stools, gotta go see a medical doctor. Don't come to a chiropractor with that, please. But when you exhaust those conditions, and everything's ruled out, then you could definitely entertain the idea of seeing a chiropractor because you have nothing to lose. You may not have a rib out of place. You may not have, the findings that we would typically find. It's kind of rare that we actually see people coming in for hiatal hernia. I mean, as a matter of fact, I'm one of a few who actually are trained to do it. There's a guy in Houston who he puts his YouTube videos up, and I would never do an adjustment like that on YouTube. But listen, he's doing what he wants to do. That's entirely up to him. So the hiatal hernia is when we pull the stomach back down, make space for the opening to stay. We want the opening to close. It's done by what's called a pyloric sphincter, and the sphincter is a smooth muscle between the pylorus of the stomach and the duodenum of the small intestines, and it plays an important role in digestion. It acts as a valve. And so when the valve is stuck open, acid comes up and eats into the esophagus. Now, you definitely don't want the, because the esophagus, the tissue will change. It's not meant to have the acidic thing. The stomach is geared up to have acid, but it's not supposed to be up in your esophagus. And that's really where the dangers come in. So it's really, it kind of behooves you to lose weight and get your diet in order to treat this. But, um, very few people are aware that chiropractors, they come in like, wow, chiropractors doesn't treat this. Well, yeah. Now, another symptom too is chest or abdominal pain. If you have chest or abdominal pain, go to the doctor, go to the emergency room. If it's that bad, please do not go to a chiropractor. I mean, yes, if you have like minor throat irritation, but still get it checked out. I mean, do yourself a favor. Do me a favor. Do not call me. I do not want to see you if you have shortness of breath, stool, your bloody stools, vomiting. It's the type of case that you get everything else cleared out. Go get the endoscopy, whether they're going through your throat and take a look at it. But it is a thing. Listen, if you do need the proton pump inhibitors, those are very powerful, powerful medications. I mean, it's like I said, I really think you have to. You'd have to really be concerned that that it's something you don't want to mess with. I mean, really, that's what I would have to say is like it's things to consider. You know, there's a bunch of different ones. I mean, and again, you're going to get that. I'm not. I don't prescribe medication, so I'm not the guy to see. However, if you have, maybe you've had some kind of trauma you could relate back, then there's a chance we can help you. So the hiatal hernia, it's obviously not life threatening, but it's something that can be helped, and naturally. And if it does, it's a great thing for everyone because one, we keep you off the proton pump inhibitors. All right, listen, I'm Dr. Brian McKay. We've been discussing hiatal hernias. If you got any questions, give me a shout. All right, thanks a lot. Have a great day and keep listening. Thank you.